Let me begin by asking each of you to close your eyes for a moment. Visualize a 7-year-old child wading in warm, tropical waters in Southeast Asia, surrounded by water buffaloes, cuddling a little wiggling piglet in her arms. Please open your eyes now. To this child, this piglet named Peggy was not a pet, as most children of her age would believe. It was a means to market, a clear path to be followed by diligently caring day in and day out for Peggy. Even at this early age, this child somehow realized innately that if she worked hard, took good care of Peggy, it would bring a good price at market. This became a true mission-driven accomplishment to achieve. This child had a vision that once Peggy was sold, she would be able to purchase a rooster and a hen. These in turn would produce many chickens, which would satisfy daily food requirements and create needed revenues, thereby generating in her own small way a positive impact, not only for herself, but also for her family members. Although this young child was born 7,337 miles from here, on the other side of the world, she was already pondering a great undone. I am sure you realize the child I have been speaking about is me. My family immigrated to the United States when I was 11 years old, where I felt, not surprisingly, like a stranger in a strange land. Can you imagine walking into my first day of class and seeing all the children seated around me, girls and even boys who I had never been with at my previous all-girls school? They were wearing what I would call civilian clothing, rather than the uniform I was accustomed to. Everyone was looking at me, and when I began to speak, I saw smirks on their faces, since my form of English was as foreign to them as theirs was to me. These early experiences resulted in my shy and quiet outward behavior during my primary and secondary school years. My interactions with my new classmates were limited. I focused on my studies, volunteered at hospitals, and participated in community programs such as tutoring inner-city children. Of course, I also spent a lot of time sitting by myself in my bedroom, daydreaming and projecting what I want to become. After finishing high school, I headed off to college, where I obtained a degree in biomedical and biochemical engineering at the University of Southern California. Even while I was immersed in studies on what seemed like 24/7 basis, I continued to devote time to community service. These activities included feeding the homeless, cleaning up garbage, and helping disadvantaged children. I even became the president of our university's international co-ed service fraternity, Alpha Phi Omega. It was during these formative years when I experienced these catalytic events that I realized there were infinite possibilities as to what I could be and what I could do to make a positive social impact locally, nationally, and internationally. After graduating college, I was fortunate to secure a job with a global software company that enabled me to embark on a personal journey that has led to extensive travel in more than 50 countries, from Cuba to Vietnam, from China to Egypt, from France to Peru, from Cambodia to Malaysia, and from Australia to Ghana. In many of these countries, I had the opportunity to observe the daily lives of children, students, and adults in underserved communities. For example, in Cambodia, I watched a child climb into a styrofoam container. He was no more than 3 years old, paddle over to me and beg for money. In Cuba, I observed how many of its citizens live a meager life, getting by with only basic necessities. The social media tools at our disposal today, such as smartphones and pads, and their associated millions of applications, empower all of us to have an immediate global impact. For example, within minutes of 15-year-old Malala Yousafzai being shot by the Taliban in 2012 for advocating the rights of women to obtain an education, her story was instantly being read on every continent, from the Americas to Antarctica, and even in space on the International Space Station circling the globe. Because of the social media we utilize today, globally publicizing Malala's horrific attack and her fearless response to it, people everywhere were informed and outraged. This led to a movement to nominate Malala for the Nobel Peace Prize, which she was awarded in 2014, the youngest Nobel laureate ever. All of us have the ability to change the world, and we are doing it. More than a decade ago, 25 years after my first Nurturing for Market, Little Peggy Peggy, I had the privilege to address a 60th anniversary event at the United Nations honoring the UN's formation and globalization of the fundamental principle that all humans are created equal. During my UN speech, I publicly pledged to choose a mission in life that generates measurable social impact. 5 years later, based on my extensive travel experiences and my background in global software deployment, I identified a huge market need to deliver healthcare more efficiently and cost-effectively. This has become my mission in life, to deliver access to digital technologies in underserved communities throughout the world. In some of the African regions I work in, they only have one doctor to serve more than 25,000 people, compared with more than 70 doctors here in California to serve the same number of people. Every minute spent with a patient is so important. Since helping has always been at my core, I created an eHealth initiative to address these issues. After conducting extensive research in 2013, the West African country of Ghana was selected as a site for our first deployment. In my positive, naive, initial approach to this, I thought accomplishing this initiative should not be too difficult, and everyone would want to join in on the task. Under the initiative, I thought I could attract large global software providers who had not yet entered the African market to join me in an effort to serve that continent's 1.2 billion people. This would be a win-win for all. The software provider captures a material share of this market at its infancy. The healthcare providers and their patients benefit from the software and accomplish my mission. After spending more than a year doing groundwork, I learned that the major global software companies were not interested in addressing this underserved market. I also soon realized that even if the software was given to us to use, where's the hardware? Even if the hardware was given to us to use, where's the connectivity? Even if these items were all provided to us, where are the necessary human resources to help implement, train, operate, and maintain the system? Facing all of these challenges, I realized that the only way to accomplish my mission was to design a comprehensive system addressing all of these issues. The solution I created is the CLOD system, an acronym for Closed Loop Data System, and I serve as the CEO of CLODS. The CLOD system specifically addresses major challenges of electronic health records implementation. It aids in diagnosis, reduces errors, improves safety, and supports better patient and public health outcomes. Having electronic health information about an entire population of patients allow providers to be proactive and look more meaningfully at the needs of patients. By implementing cloud systems in underserved communities, we are making available proven technologies that are foundational tools used by healthcare providers in developed countries. As we connect healthcare facilities region by region, the measurable social impact I was looking for is generated. Undertaking any great undone is not easy, especially in underserved global regions. My mission is no exception. It has been an exhausting multi-year process. It has been a long journey with many challenges, a long journey with many disappointments, but also a journey that has given me joy and fulfillment, knowing how the cloud system will forever change the lives of people by improving the delivery of their healthcare. I am especially humbled each time strangers who hear about our project say to me, "Keep up the good work you are doing." Even though we are underway, we are still facing many obstacles. These challenges include health-related issues, from small malaria-inflicting mosquitoes to outbreaks of Ebola, the always present challenges of funding, government regulation, and political issues, and lastly, but not the least, personal security and terrorism. Equally challenging is ability to communicate excitement and enthusiasm for our project. For example, during my first meeting with a head of IT at a large regional hospital in West Africa, the staff member did not give me a good reception. He wanted to walk out of the meeting thinking we were just another vendor selling something, let alone having to listen to a non-African woman lecturing on IT. After I was given the opportunity to explain who we are, what we are doing to improve the delivery of healthcare, and the vision we have, he immediately signed on to help us in any way. To this day, he remains as one of our best advocates. On a lighter note, but reflecting similar initial impressions, is what happened to me when I attended a small dinner at a regional leader's home in Africa. Within the first 10 minutes after our arrival, the leader's wife came out to welcome us. Not knowing who I was and that I was there to speak about our project with her husband, the wife kindly invited me to help out in the kitchen, where I would feel more comfortable, and leave the man to talk about the business at hand. In response, I smiled and graciously declined. These types of actions do not surprise me. When I was in engineering school in the 1990s, I was one of only a handful of women in my major. When I was globally deploying software in the early 2000s, I was always the only woman on my team. What I have learned from my experiences in accomplishing my mission is that we get far better results when we draw upon a holistic approach. We need to apply not only what we learn in academia or read in books, but also, most importantly, what we learn from what we personally witness and experience in our daily lives. As my brother Michael says, a goal without a plan is just a dream. To find one's true life's mission, one must seek it out. Let me share with you some helpful hints I learned along the way. To set your course in choosing a mission in life, you need to ask yourself, how do I do this? First, believe that you have infinite possibilities as to what your life's mission can be. Second, from this unlimited set of infinite possibilities, you need to pick something that you are passionate and enthusiastic about, which will permit you to utilize unique skill sets unique to you. You may not be successful with your first, second, or even third attempt, but do not despair. Persevere, and you will find your own great undone to challenge. Third, get a team of people who believe in your cause, who you can count on to join you on your journey. Only through collective efforts can your idea be expanded into a local, national, or global movement. Notwithstanding all of the challenges we face, our planet is still one beautiful piece of art, created in the most divine form, but also bleeding from the ravages of war, modern fears of terrorism, poverty, and lack of access to emerging technologies. Today, all of us are citizens of the world, and as such, it is our duty and responsibility to ensure that all people are given the ability to live a life based on freedom, justice, and expectation of peace, and access to emerging technologies. Who other than you have the actual power, decision-making capabilities, and are technologically savvy to address these seemingly overwhelming challenges? Let today be truly historic for you. Let it be because you realize that all of us have the ability as a single individual to effectuate positive global change. Let it be because you are inspired to commit right now to personally tackling a great undone. Choose a mission in life and stick to it. What you do and how you do it may change, but never change why you do it. Do it for yourself, with passion, excitement, enthusiasm, and a mission to generate measurable social impact. Each of you has the ability to do this. There are no truer words than those spoken by a young man of my age at his inaugural address. Let us always remember what President John F. Kennedy said. Here on earth, God's work must truly be our own. May God bless each of you as you journey on your challenging but exciting mission in life, tackling your own great undone.